Welcome to the Deep Dive. Today we're tackling a subject that's, well, incredibly sensitive, but also vitally important.
Absolutely.
We're doing a deep dive into the physical health consequences of female genital mutilation cutting, or FGMC. Getting the facts straight here is just crucial.
It really is. And our guide today is this huge scientific review published in BMJ Open. It's a systematic review and meta-analysis.
Right, not just a small study.
Not at all. They looked at 185 different studies covering, get this, over 3.17 million women. It's probably the most robust evidence we have on the physical side of things.
Wow. Okay, so our mission for you listening is to really unpack what that science tells us, the immediate effects, the long-term health issues. Let's start at the beginning, though. What exactly is FGMC and how widespread is it?
Okay, so the official definition is basically all procedures involving partial or total removal of the female external genitalia or other injury to the female genital organs for non-medical reasons.
Non-medical being the key phrase there.
Precisely. The WHO, the World Health Organization, breaks it down into four main types. Type I is clitoridectomy, removing the clitoris partially or fully. Type 2 removes the clitoris and the labia minora.
Okay.
Type 3 is often called infibulation. That involves narrowing the vaginal opening, creating a seal. And type 4 is kind of a catch-all for other harmful procedures: pricking, piercing, scraping, burning.
Goodness.
Yeah. And each type, carries different levels of risk. As for scale, the estimate is staggering. Around 125 million girls and women alive today have undergone FGMC.
125 million.
Yeah.
That's a sobering number to start with. So the study you mentioned breaks down the impacts. Let's talk about the immediate aftermath first. What happens right after the procedure?
Well, the review found some really common and often severe immediate complications. Number one was excessive bleeding, found in a median of 32% of cases.
Almost a third.
Yeah. Then urine retention, difficulty passing urine in about 31%, and genital tissue swelling in around 15%.
And these aren't happening in sterile surgical environments usually.
Far from it, often. It's crucial to remember this is frequently done without any anesthesia, sometimes with crude, unsterilized instruments. That just ramps up the trauma and the risk massively.
Right.
And the study did point out that type 3 FGMC, infibulation, generally carries an even higher risk for these immediate harms compared to types 1 or 2.
It's hard to even imagine. Okay, so those are the immediate dangers. What about the long run? What chronic physical issues did the review connect to FGMC?
This is where the sheer volume of data really shows its strength. They found statistically significant links to several long-term problems.
That's as.
Okay, so in terms of genitourinary health, think or urinary tract and vaginal health, there was a significantly higher risk of urinary tract infections, UTIs. The unadjusted relative risk was 3.01.
Meaning women with FGMC were 3 times more likely.
Essentially, yes. And
Right.
also bacterial vaginosis, BV. The adjusted odds ratio was 1.68, so about a 68% higher chance, even after accounting for other factors. There were also trends noted towards painful urination and various menstrual problems, though perhaps not reaching the same statistical certainty across all studies.
And sexual health.
A clear link there, too. An increased risk of painful sexual intercourse, what doctors call dyspareunia. The relative risk was 1.53.
So over 50% more likely to experience pain.
Correct. And then obstetric outcomes, what happens during childbirth, were significantly affected. Higher risk for prolonged labor, an adjusted odds ratio of 1.49.
Right.
Higher risk for needing a cesarean section, AOR 1.60. And a higher risk for difficult delivery overall, AOR 1.88.
These aren't small numbers. They represent real danger and suffering during childbirth for millions.
Exactly. It's a pattern of chronic pain, infections, and dangerous childbirth experiences.
Now, you mentioned earlier, and the study highlighted, what it didn't find a statistically significant link with specifically infertility and HIV or STIs.
Yeah.
Why is that important to note?
Well, it's about being precise and focusing on what the evidence strongly supports. There are many misconceptions out there. While the proven harms are devastating, it's also important for, a balanced picture to state clearly where this large-scale review didn't find a direct statistical connection. It helps target efforts correctly.
That makes sense. It leads to a critical question, though. Studying something this sensitive must be difficult. How confident can we really be in these findings given those challenges?
That's a very fair point. And yes, there are challenges. Different studies use different methods, and there's always the potential for underreporting because it's such a sensitive, often hidden practice.
Yeah.
But, and this is the key takeaway from the review's authors, the consistency of results with increased risk of several physical harms is robust.
Robust despite the challenges.
Yes, when you have data from over 3 million women across 185 studies, all pointing in a similar direction for multiple health issues, that carries enormous weight. Even if the increased risk for some things might seem statistically modest in some analyses, any increased risk from a non-therapeutic procedure is, frankly, unacceptable from a health standpoint.
The sheer weight of this evidence, it really underscores a crucial point, doesn't it?
It absolutely does. It shows, quite unequivocally, that FGMC is, as the researchers put it, a non-therapeutic procedure. It provides no health benefits whatsoever.
And instead,
Instead, it acts as an actionable risk factor for several morbidities throughout a woman's life. It actively causes harm.
so for you listening, this deep dive hopefully provides that clear, evidence-based understanding of just how profound the health implications are. It raises a final thought, perhaps. When the scientific evidence weighs so heavily against a practice, showing direct physical harm, regardless of its cultural background, what responsibility do we all have globally to support those affected and, crucially, to work towards preventing it for future generations? Something to think about.